Hey everyone, Dr. Reams here with Dr. Reams Concierge PT. Today I'm talking with John from Sigvaris. First, we're going to talk about, what is Sigvaris, why they, do what they do, and really it speaks to the quality of their product and why we like using their products. So John, introduce yourself and tell us a little bit about Sigvaris and you.
Awesome. Well, thank you so much for having me, Kaylee. My name is John Hoffman, and I've been with Sigvaris for the last 5 years. Previously, before that, I was part of the BioCare company that Sigvaris purchased. So I've actually been kind of part of the family for over a decade now. And what I particularly focus in is our wraps and our more complex products for our patients with lymphedema and lipedema. And then we also, as a company, focus on vascular and circular knit products. So Sigvaris as a whole started way back in the 1850s and was a family-owned company and is still to this day. They started in textiles and then got into medical hose compression in the 50s. We are a European-based company, so in Europe, kind of fashion is big, especially in the compression space. So we looked at providing both fashion forward, athletic, hiking, just a wide variety of socks to really fit everyone's everyday need. And then about 5 years ago, the market kind of expanded in the understanding of vascular and its connection to lymphedema and the importance of lymphedema and how many patients were kind of getting left out, really kind of came to a forefront. In Sigvaris purchased BioCare with our wraps and our lymphedema products, and really started focusing on how we could expand our reach into the lymphedema and lipedema space. We recently hired several clinicians that work for our company full time now. And so we've been able to focus even more on growing our lymphedema and lipedema channel with those clinicians.
Yeah, and you and I will be talking about that lymphedema, a little bit of lip, but not necessarily my bread and butter. But I know I've treated patients from Europe, and that fashion piece is huge to them. Like, they're shocked that here in the States we go to the grocery store in our athletic clothes. and lymphedema is so well recognized over there, especially in Germany. And so to see, you all recognizing it over here and helping people recognize it here is huge.
Our main office is based in Switzerland, and we have several manufacturing plants around the world. And so in Switzerland, they have that European look and feel. The insurance and the coverage is a lot different for both vascular and lymphedema. And so it's been kind of a bit of a process for us to help them understand, for them to help us understand. And so we've been able to learn a lot about how things differ and how the treatment takes place there, how it's quite a bit different here, and how often garments can be used when we're not able to see our actual therapist as often. And so it's kind of been great for both of us to grow our channel here in the understanding of bandaging and that importance, while also seeing how our garments and things can help people in Europe.
Because it's two different worlds, unfortunately, right?
For sure.
We wish we'd have some of the care that they have over there, and some of the coverage we have here they don't necessarily have there. I have patients that stock up on garments here, they can get them covered here where they can't there. And so it's really interesting, really two different worlds when it comes to lymphedema and compression and all that. But you talk about how you're bringing in clinicians and, you've been part of the family and stuff like that. And that shows in the products is, these aren't people just, oh, I see a medical product I can make money on. This is stuff that people, have experience within their family or loved ones and wanting to help create a solution. And so can you talk a little bit about that?
My first experience, I was 15 years old, and I helped my dad, who was the previous president of BioCare, help set up the factory. So I was a kid, like working for McDonald's money or whatever, moving heavy stuff and like kind of helping get this situated. And I'm in my mid 30s now. So almost 20 years of my life has been kind of around these patients. And the method that we used back in BioCare day and that we still use now is just working directly with patients and therapists. Our head R&D seamstress, she had quite a bit of background in textiles, but her husband was a therapist, a PT. I think he's been a PT for over 35 years now. So we all kind of had a bit of skin in the game, so to speak. We had family members with personal medical issues that were kind of resulting in the need to get compression. And this was a space for us to be able to look at that, but not really understanding everything ourselves. What we would do, of course, is go to the experts, which is you. So all of our products, a chip flow, one of our products that we released relatively recently. I was at the factory when one of our patients came. She stayed a couple of days in a fifth wheel or in a motorhome in our parking lot. And we literally created products and put them on her legs and like, all right, go sleep in that, see how that works. And that's kind of been our process. So I think a lot of therapists and patients have made note about features that are specifically beneficial to patients. And that's because patients helped us develop them, therapists help us develop them. I definitely encourage anyone that, especially the therapist that may be watching this, reach out to your local Sigvaris rep and talk to them about the products, because it makes a change. We make changes, we make products and develop them based upon our interactions with you.
Yeah. And they don't know that there's a struggle with one product or something unless they're told. So if you see a pattern happening of patients unable to reach here, or it's fitting funny here for this population, talk to them. Odds are they're going to probably try and find something to help.
Exactly. That's I gotta say, my favorite thing to do, a big part of my job is helping a therapist understand like how our products are meant to work, so that you can tell me this is what's wrong, this is what I need for my patient, and I can say, okay, this garment is built to do this garment's built to do this. Let's find that solution that's gonna help this patient.
And I know from a therapist standpoint, there are so many garments out there, yours, other companies, you name it, trying to keep track of all of them is extremely difficult, especially when new stuff is coming out, right?
Yeah.
And so having those relationships makes a big difference. I'm very familiar with some of your products, but even prior to these chats, right, is you brought up stuff, I'm like, oh, what's that? And so having someone, that you trust and that you can talk to about new products that are coming out, or maybe you got a patient that now makes sense of this other garment that didn't really stick in your head before. So building those relationships and knowing that your all's team is there to help us kind of know the different products and what's available. Because the best compression, honestly, is the one that the patient's going to wear.
Exactly. I can't agree more. When I teach, I'm part of our training team, and I teach about fitting complex products. I always talk about the 3 C's. I fit first to the condition that I'm told that they need, and then I consider their compliance, whether they can don it, whether they will wear it, and then the cost. Because often the condition may call for something with foam and with high containment, or maybe even a custom, who knows? But if they can't afford it, or if they're not willing to wear it or can't don it themselves, it's just going to sit in a drawer somewhere, and that doesn't do us any good at all. So that's part of my method is looking at giving you the best suggestion for medically what's going on. Our garments are made to do this. This will work best with that medical condition. But let's also look at the big picture here, because we need to make sure that the patient's able to don and afford the product, or get coverage if they're able to. And we know that coverage can be hit or miss, and sometimes you can get coverage for this and not for that. And I can help you kind of wade through that as well. Our whole team can. That's what we're here for.
Which is huge. And it's unfortunate. I've met a lot of therapists and stuff like that don't know their resources to help get these garments covered for patients.
Yes.
And that's heartbreaking for me. Is the way I was trained and whatnot is I have a phenomenal resource really close, but a lot of patients aren't aware of some of the coverage that is available. It's not always available, and hopefully rules are changing as we speak.
We're always
in
fighting
2022,
for it, right? Always fighting.
But having someone to talk to about that, and if you're not close to me or anything like that, reaching out to the Sigvaris team to figure out how can we look into coverage and stuff.
I think that's a
Huge.
great point too, just where to go, right? I have a number of places I suggest for cash, in person or online, kind of depends. A lot of it deals with people that I've trained personally. I have Compression Guru. I think most people know Compression Guru, right? Great place to go, great cash price, but also, we've done training with them. Lymphedema products, Bandages Plus, there's a few of them. SunMed, I just did training with this week. The people that we look for are people that have the skill to bill, as I like to say, and then we try to invest in that as well. Sigvaris is looking at and does active trainings with these companies because we want to make sure that the person that's answering that phone also kind of knows what they're talking about. So whether it's myself, whether it's the local rep, that person will be able to help you determine based on if you are looking to pay cash, whether you are looking to check your insurance, whether you need someplace close by local to help with that fitting, whether it's, cheapest price available, just get it to me. We can help you determine that and cut out some of the noise. So we like to help you guys find those places that have excellent fitting, excellent customer service, excellent help with billing, or the best prices for cash.
Yeah, so that's for therapists or patients even, right? Is I've had patients reach
Exactly.
out on my social media pages of, I live in Ohio, right? How do I find someone that'll help me with my garment? And I will go on websites or reach out to my reps of, Sigvaris and whatnot. Who do you know near here that does this? Because I may not know directly, but I know I can trust, Sigvaris and all of that they've trained someone. They're not going to put someone or tell me about someone that they're not going to back.
Exactly. And it really comes down to just considering wanting the best experience for that patient. And so because we want the best experience for the patient, we try to go a little bit above and beyond, I think, with the training and the process for who our patients are going to. We want them to also have that same level of care that hopefully they would get from myself, from their local rep, from whoever's representing us as well. So we put a lot of time and care into that. And if someone is a Sigvaris dealer, you should know that going in there, they're going to have some fitters there that are trained by our staff to know how to get you into the right product with the right fit and something that will be comfortable for you.
Yeah. So we've talked a lot about kind of how you guys have products and whatnot. So stay tuned, you all. We're going to do some videos about different products they have, and showing off why we love them so much and what makes them appropriate for different things. So you all keep watching these different videos we have and reach out if you have any questions.